Okay, hi everyone. We are here today for a summary of our November gatherings, which we did virtually and in person last month. Um, I am Jim Bennett. I am the Regional Support Facilitator for Region 6 and also part of Region 2. Here with me today is Ms. Leslie Powell. Hi, Leslie.
Hi, Jim. My name is Leslie Powell. I'm also a regional support facilitator for Region 5 and part of Region 2. So welcome, everyone.
Right. And we all kind of split Region 2, so there's five of us across the state and in different regions, and then we split Region 2. So, but thank you for joining us today. We are going to go through sort of a recap of our November gatherings, and want to start off by thanking everyone who attended those gatherings, whether it be virtually or in person. Also wanted to call out, last week there was some tragic news, an accident in Geauga County that involved some folks who received services and a staff person from Cuyahoga County. Um, Thinking about you all, we from the department standpoint, Leslie, on behalf of the department, Leslie and I are sending our thoughts and prayers to you all who are going through that tragic accident. Also wanted to call out, I know a lot of people have kind of questioned, well, why are we doing this now? Why are we, people don't have time. We've got a pandemic. We've got a workforce crisis. We certainly understand that. And just kind of wanted to mention that, a lot of this work regarding the Ohio ISP began back in 2019, prior to the last year and a half worth of craziness going on with the pandemic and the workforce crisis. The pandemic really has kind of slowed us down, just pulling people in different directions as we've really tried to focus on health and safety and those things that are important. But we also understand that as we transition to getting the standardized Ohio ISP in place, that we have to get information out. We want everyone to be prepared and ready to go. So we're trying to kind of balance those things out. So again, appreciate everyone's time and effort along the way, all the work that you all have done on the ground, kind of working through this. So appreciate that. But kind of moving forward here, guess want to start with what we did back in October. And there's a really nice summary that was done by Mandy and Kelly from our RSF team that is on our Ohio ISP website that you can check out. But we talked a lot about the communication and advocacy and engagement sections and just kind of went through those in detail. We also talked a lot about facilitating communication, and as part of that, we're going to have a resource available from some of those great responses that we got from SSAs and Qs. Les, do you remember some of those ideas that people had as far as how to structure communication?
Yeah, absolutely. We got such great feedback, Jim, when we have been talking to the SSAs and the QIDPs, and they really took some time to share. Everyone was different. Some SSAs say, hey, I asked questions, and it's just part of the communication. I sat down, had a cup of coffee, and we just had a conversation. Another person said, it was very important not to ask those questions in a formal meeting, because some of those questions are private and they don't want to be discussed openly. But I believe that we're developing a resource with all that information. And again, keep going to our Ohio ISP webpage, because you're going to find these resources. But, we're really taking the time to listen to this advice and being able to share that, on the website. So hopefully that will be up there soon.
Yeah, if it's not already, it should be up soon. So I, again, just the conversations, Leslie talked about environment and just kind of being informal. I mean, remember, these are assessment questions. We're not talking about a formal meeting, necessarily. So just kind of where the person's comfortable and having a relaxed conversation as opposed to just like rapid firing questions
Right.
like it's a job interview. No one wants to be in a job interview. So I think in a lot of our in-person gatherings, we've had people pairing up and asking questions of each other. So not just asking the questions, but having those questions being asked of you, I think really helps to gain a lot of perspective as far as how we ask questions to those that we serve.
Correct. Right. Thanks, Jim.
Yeah. So as far as our November gatherings, which again we just kind of finished our virtual and our in-person gatherings, what we talked about were specific assessment sections, and those were safety and security and social and spirituality, and those kind of went through a deep dive of those sections, and we'll talk about that a little bit here today. But again, this is just kind of a recap. So we got a lot of questions about specifically, well, what do we put here and what do we put here? We do have a sample plan that we're going to go through, and we'll talk a little bit about that. But again, continue to encourage those attendance at those in-person and virtual gatherings as we have them. We did talk a lot about supervision, so those questions will come up, and we'll recap that here in a bit, as well as behavior supports and restrictive measures, and just kind of how to interweave those within the plan. And then our theme throughout has been building confidence, competence, and connections. And again, I think it's really great when we get a group of people together that maybe haven't been in the past, like SSAs and Qs, kind of worlds colliding where we have that interaction and sharing great information. And we have a lot of other folks, supervisors or cogs or other people that kind of come in and provide some feedback as well. So it's been a really great experience thus far. But as I mentioned, we went through a deep dive of a couple of our assessment sections, and that's kind of been our pattern throughout. Our plan has been to address a couple of these each month, and then kind of moving forward. So remember, we're still kind of in that assessment section here as we go through, and we'll talk a little bit about bridging that to the ISP later on. But I'm going to turn it over to Leslie and see what she has to say about this deep dive here.
Thanks, Jim. So, as Jim said, we're moving forward and doing an assessment deep dive to safety and security and social and spirituality. And, I just kind of want to remind the SSAs and QIDPs when you're in this section, just to remember, you might not have to ask all the questions if they don't apply. So you're just going to skip over them. But moving forward, when we're looking at Rose Crawfish, her sample plan, that's who we're going to be, talking about. Again, this is just a recap. We want to let you know that under the safety and security, the bold are the primary questions, the italicized are just conversation prompts. And, sometimes that's beneficial when you're really struggling to have that conversation and looking at not only having the conversation, but just kind of rewording it to help the person understand what you're asking of them. And, you also may want to look at getting some input from other team members, important people that are in the person's life, especially if the person is not able to, give you that information or may not understand what you're asking. And I also want to kind of point out with the safety and security, that first question. That is a very great place to put anything that's related to emergency safety drills, the fire drills, tornado, any information about, if somebody, doesn't have good traffic skills, those are things where you're going to put that place. And then, when you're thinking ahead of your summary with skills and risk, we want to make sure that information you're capturing in the summary. What else do we need to know? And, you may be looking at stuff and realize that maybe you're missing something. It's okay. Go back. You can add that information, or you might be, realize that, hey, that person doesn't have an issue with that anymore. So we need to remove that. But you're really going to take a look at that safety and security, and behavior well-being and emotional well-being. Jim, you want to talk a little bit about that?
Yeah, yeah. Thanks, Les. That those first couple questions of that behavioral well-being section really get at restrictive measures, right? Like risk of harm to themselves or others. You're looking at likelihood of legal sanction. That's really what kind of defines what would be a restrictive measure. We may not get in the restrictive measures quite yet, right? Because that's more of a planning type thing. But we're looking at things that may present that risk of harm or likelihood of legal sanction. So we're doing the assessment. Remember, we're in assessment still. We're gathering information, and then that planning kind of comes later on. That other question there in the behavioral well-being section, it's a question from the DDP, I believe, and again looking at behaviors that may require environment to be structured a specific way. So, again, we're just kind of information gathering at this point, and like Leslie said, I think we start with the person, and then as we need to fill in gaps later on, that's when we kind of we talk to other team members and we get some of that important information from others as well. So yeah, that's I think this section here, you got all those different subsections: safety and emergency skills, behavioral well-being, and then emotional well-being, which is important as well.
Thank you, Jim. So, moving on to the next slide, again, we're continuing with Rose Crawfish's sample OhioISP plan. And, you're going to look at some of these questions and being able to, again, look for the person to give you the information. And, you look at the second question, it says, what does the person believe would make their life better? That's kind of a hard question. Don't you think, Jim? It's like, somebody asked me that, I'd probably have to sit down and think, and I don't even know if I could come up with the answer. So you're really going to, talk to the person. You might want to rephrase it. You might want to talk to the team, that are important to that person. And maybe it's a potential outcome. Maybe we dig deeper and we talk to, Rose's Aunt Joni and say, hey, what would you think that Rose life? How can we make her life better?
Yeah, is that even possible? Because it
Right,
sounds like Rose wants to live next to Aunt Joni. Um, is Aunt Joni even able to make that happen? So, you want to be realistic in sort of what you come up with there, but that's a great question for an outcome, right? Like, how could your life be better? What do you want to have happen?
right, absolutely. And then, you look at the bottom and, the question says, what makes a person's day better and what makes the day worse? And many of these questions are just coming from a good day, bad day. It's a person-centered tool, and, it's basically to help structure the person's day. I know, and, you know, I look at, if I don't have a cup of coffee in the morning, it's going to set my day for not being a good day.
You're not the only one. I'm sure there's a lot of people that would feel the same way. Yeah, and it's
Yes,
like, what do we want to promote? Like, how do we structure things so that people have a better day? And like, what do we try to avoid so that they don't have a bad day. I think that's how all of us try to live our lives, right?
Right, right. So, we're moving forward.
Yeah, just
We're
one
look
other thing, Les,
Okay.
if I can. So that best thing that ever happened to the person question, I think that's an interesting one as well. Like, I know we had a lot of discussion during our gatherings about that one. Like, it looks like Rose's best thing that ever happened to her was having her picture taken with LeBron. Like, and she carries that around. I think that really kind of shows some perspective. So, like, obviously, Rose, like that if that's the best thing that ever happened to her, that carries a certain type of special meaning. And, we don't want to downplay that. I think, like, for a lot of us that have maybe had different opportunities, we would talk about best things that ever happened to us being related to, like, family, like, marriage or kids or something along those lines. Maybe it's something career or educationally based. I think we have to remember that, like, a lot of the folks that we serve haven't had a lot of those same opportunities. So it's really about kind of getting that perspective and what's kind of meaningful to that person.
Absolutely, absolutely. Thanks for sharing that.
Yeah.
So moving forward, we're looking at the supervision, and you know, before we even go into this, I just want to let you know that we're aligning all of the supervision levels as pre-assessments. You're getting that from the OEDI, COEDI, any type of assessment that you may be completing. You're taking that in consideration and you're answering the questions here. And then remember, like, we're still in the assessment section. This is not a place where we're making any kind of decisions regarding supervision. We're just basically kind of like looking at those assessments and, how does it fit into, these questions. Um, so the assessment questions are designed to ensure that any pre-assessment information is considered when identifying the level of support, supervision that somebody needs. It's just general information that what we've learned through the pre-assessment. And you look at it and you're going to go back to the important two, important four, skills and abilities, known and likely risk, and if it's a potential outcome. And again, this is the summary. This is a summary that of all the information we've already learned. And there's nothing new. And if there is something new, we need to go back and say, okay, where's this fit? Because through conversation, you might find out something. Say, hey, we missed this.
Yeah, that's great points, Les. I think that supervision question, just kind of going back to that real quick, as you mentioned, like, it's the results of the pre-assessment. So we're not like determining what the supervision level is going to be. Like you said, it's just kind of recapping what's already there, because that's sort of the path you follow. You do the pre-assessments and then you get into assessment and then planning. So, there's sort of that path that you follow. And we want to make sure everything aligns. Like, oftentimes we find, the results of the LOC or the DDP, like, don't match with where we're at now. And we want to make sure that we're capturing that information that we've already gathered. And then, we've got it now here into the assessment, and that's going to drive, where we go with planning as well. So, and then, like you said, that summary section is really important, because even though it's right, you're getting some of that information from what you've gathered in that section, that's going to carry down into, it's going to populate over in the ISP in the planning portion, because when we have the IT solution, that's what's gonna that's what's gonna pull over. So I think, it's, whilst times it might feel a little repetitive, like we're capturing information we've already put down, I think it's important to have that good information there, so that that pulls over into planning.
Right. So going again, to, the next section, which is social and spirituality. And, it talks about, any clubs or organizations, where do they hang out, talk to people. We really want to take a time and, ask that information and talk to family, friends, or, important people, because it's so important that they continue to have that experience. And we want to kind of spell out, what things are. With roses, it talks about, holidays with families. Why does Rose like that? It really, we're not digging too deep. We need to know, like, why does she like holidays with her family? Is it because that's the only time that she gets to see her brothers and sisters? Is it because she gets gifts? We just kind of made that general statement, but we really need to look at it and ask those questions and be specific about why she likes those holidays. And moving forward. And then,
Right. Because
again,
most people enjoy holidays with families, right? I mean, most
right,
people, not there's some probably coming off of Thanksgiving, there's some people that are like, nah, I could wait a little while, little quick turnaround here before Christmas. But no, but most people enjoy them. And like you said, I think it just gets to, well, why? Like, why does she enjoy them? What is it specifically about it? Is there a specific holiday that she enjoys more than others?
right, right, absolutely, absolutely. So, going forward again, we're looking at friends and relationships. And, this might sound to be repetitive. And, we asked previously in the other section, um, you know, who helps that person make a decision. And it might be similar people, it might be completely different. She might ask her Aunt Joni to help her make decisions. And she is an important person in her life, but they could be different. So you want to take that in consideration. And you also want to make sure that you're basically, putting down who those people are and just not the DSP. Because if you're looking at that, that really doesn't tell the person who's reading the plan. Like, if I need help with somebody, if Rose is having a hard time and she needs help, or I need to talk to somebody about what's bothering Rose, who can I talk to? And right there, it's listed. I can go to Tony J. He's one of the people that work with her and is going to be able to help me go through something and teach me. So it's really important to make sure that you're doing that. And
Yeah,
one
and you mentioned it, Les, like those important people may not be the people that you trust to make decisions. So it does seem like there's maybe some repetition or some overlap, but really it is kind of getting at something different. Like, we all have that friend that, you is important to you, but you certainly wouldn't trust their advice for so I think the struggle sometimes, and our one of our managers, Heidi Davidson, mentions this a lot. Like, when you have someone's life put on paper, there's going to be repetition. It's hard to put them into 7 separate boxes and kind of put everything in one area and not have it cross over. I think there's just naturally going to be repetition, because life is kind of like that. It's just going to have we're going to naturally have that crossover.
Right. And one of the things, Jim, we surely, when it comes to friends and relationships, over the last 2 years with the pandemic, I sure have learned new ways to do things that I would have never even attempted during, a regular year. But I've learned, in order for me to communicate with my kids who are out of state, I've used Google Duo. which, I didn't even know. There's so many virtual apps and there's so much technology out there now. Look at us now, instead of in person, we're doing virtual trainings. So there's just so much opportunity that you can think of. And, one of the things I do want to mention, and I've said it before, there are technology pieces where, there's an app called Meetup, and you can download it on your phone and be able to either start your own group and socialize, or you can join a group that maybe you're interested in, I don't know, hiking, we'll say. You can find that in your area. But I just wanted to kind of point that out, that we're all learning, and we've all have been forced to learn to do things differently in the last 2 years.
Yeah, that's great, Les. I mean, I think there's just a ton of technology and information out there that could really benefit people who receive services, and so just kind of being creative and kind of looking at what opportunities are out there is a really good place to start.
Right, right. So, going again to the next, set of questions, taking a look at it, we don't want to assume that everyone is not interested in dating or relationships. And sometimes, we're asking these questions, but the person's never been asked or has never been given an opportunity. Maybe they don't even know, what it feels like to have a relationship. So, we really want to take a look at that and dig deeper, and try to have, if that person's interested, yeah, I would like to do that. I would like to set up time with friends and go to the movies every Wednesday. Making sure that is going to happen, and what a wonderful outcome that would be, to be able to meet up with, other people. And then, talking about education and training regarding relationships, is it warranted? I had asked a question to a young man, about relationships and understand about dating, and was he interested? And he just kind of flat out told me it was none of my business. So I didn't answer that question. I just said that, he would like to keep that private.
Sure.
But that's, that person might need some training. You look at when people are doing social media with Facebook or, TikToks, being able to educate them on, the good and the bad. And, I, just looking at the sensitivity, and we want to make sure that we're curious and respectful to the person. And some people were more open about information than others. Just, that the gentleman I talked to, basically, again, he wanted to keep that private. That's okay. And, we moved on.
Yeah, and I think this is a great reminder that this is why we start with the person, right? Like, we ask them the question,
Right.
we ask them to get their insight, their input, and we don't just assume that because they've never been in a relationship or because they've never dated before, that they wouldn't be interested moving forward. We talked before, like, the opportunities for people who receive services just haven't always been available at the same level, for people as they are for people without disabilities. So, like, I think just kind of taking that in consideration, getting that directly from the person, and then, like you said, kind of going from there. Like, do they need more education? That sort of becomes part of that planning and support process as we move forward.
Absolutely. And so, moving forward, we're looking at the social and spirituality summary. And when you look at it, this is nothing new. Again, it's at every end of the section that we're discussing. It talks about the important twos, the important fours, the skills, abilities, known and likely risk, and it just calls it out. And, again, you're going to look at your supports, if they need support, if they have paid support, whatever. And I had mentioned, her, going and meeting up with her friends could be a potential outcome, and that could be marked. And we're, it's just ongoing themes. So the assessment will continue to overlap with information, and, it's okay.
Yeah, and actually, I think that's like a great way to obtain outcomes, right? Like you look at important twos and fours, like you kind of look at themes throughout different sections and things that might repeat that, things that aren't happening for that person. I think those could be really good potential outcomes because I know a lot of QIDPs and SSAs really struggle with, well, like what's the outcome going to be for this person? And I think that's really a good way to find those outcomes.
Absolutely.
So,
So, go ahead,
so
Jim.
oh, well, this is this is the point where when we were doing our in-person and virtual sessions, we had a little activity. The in-person sessions, I think, were really unique in that we were able to allot some time while people were there, and we were able to have some good conversation back and forth. Like I said, I think those were really productive because we heard a lot of people talking, and they were paired up. So we had one person asking questions for one section and then responding to the questions for the other section, and vice versa. So it was a really neat exercise, and I think people gained a lot from that experiential part of it, like actually asking the questions and answering them with another person. So, we talked a lot about it, and like I said, we've got some really good resources that are being developed on facilitating communication and kind of how to get that information from people. I know a lot of people said that when they were asking the questions, they kind of let the person guide them with where they went. Like it wasn't always just like, I'm just going to go right down in chronological order here, and ask questions in the order that they are in the assessment. They found themselves bouncing around a little bit, which was fine. It was good. And I think that's how natural conversation flows. Um, so, I know a lot of people, Les mentioned earlier about the italicized prompts. A lot of people found those really beneficial. So it wasn't like, you're just reading through the bolded questions necessarily. Those are kind of the primary questions, but they found themselves like leaning on those conversational prompts a little bit if someone got stuck or they needed to get some more information or there's something specific they wanted to call out. I think they found those really beneficial. Les, were there anything else that you learned from the gatherings that you had done? Any other insight?
I just know that, walking around and hearing the discussions, and, some people came back and said, I don't know this person I'm asking questions to, and I felt a little bit uncomfortable, asking that question. And the person who was being interviewed was also coming back and said, like, I don't know this person. And I felt really awkward kind of answering those questions. And it kind of made me feel uncomfortable. And it made me really think, looking at as an SSA or a QIDP, how to present those questions in a tactful and respectful way. So I think that's all important. And, each time we do a session, I learn more and more, and I just appreciate all the feedback that we're always getting.
Yeah, because a lot of you all have done this for a long time, and really, I kind of leave these gatherings learning more about how to go through the process and how to do that job then I end up presenting, because it's really, you all are the experts in this. So, we're
Absolutely.
kind of moving into the Ohio ISP in this brand new world, but we're also taking back information from you so that we can share that with others, and make sure we're getting all that good information out there for folks. So we did talk about a couple, we call these trending topics, a couple, like, things that really stood out in the sections that we covered. And obviously Leslie was talking a little bit about supervision earlier, and there's an assessment question that asks about supervision, and sort of kind of getting at some of those definitions that we have now to kind of standardize things a little bit more. And then interweaving items, kind of getting at some of those behavior supports, and even just tying in general information. We talked about how things could live in different sections, because our lives aren't just in 7 different areas. It's not kind of compartmentalized like that. We kind of have overlap. So we're going to talk a little bit about this here, as we kind of summarize what we did. So as we go into supervision, I want to call out first and foremost that this particular slide here, in this particular area, this is in the ISP portion of the Ohio ISP. So we've talked, to this point, we've talked about assessment, and the sections that are covered in the questions that are covered in the assessment section. Here we're kind of bridging over into the Ohio ISP, into the ISP portion of it. And this is where we kind of do our planning. But we don't want to skip ahead. Like, we just felt it was really important to kind of call this out here, because we know as we're getting questions about supervision and the assessment, kind of how that carries over. So I think really what we're looking at here in this slide, if you look at the known and likely risks, and we talked about in the summary sections how items from the summary in each section carry over into the ISP. Well, if you look down here in the assessment area, and I'm going to pull out my laser pointer. I did this in the virtual sessions, and it was a big hit. I got to work on my laser pointing skills. But this first area here, what is the risk, what it looks like, this information carries over from each section. So you got your communication, and it'll go through each of the sections. We're only showing the first 4 here, because those are the only ones that we've covered thus far to date. But when we get to the end of the assessment, it'll populate all of the risks and the known and likely risks from that assessment section. So those will populate here in the IT system. If you're using the paper version, you would just copy and paste those over. And for rows, there's obviously quite a few. There's quite a few risks, known and likely risks that were developed. And remember, these aren't just restrictive measures. These are just risks in general. Could be a risk of choking, or a falls risk, or something like that. Here, we're calling out when she says, "I'll cut you deep," and then building from there. So when we look at what the support must look like and why the person needs the support, well, yeah, this is because she says, "I'll cut you deep," and this is kind of related to communication. She's making that comment. What the support must look like, well, we have to lock our knives and scissors, because when she says that, she's at a risk of self-harm. And then we identify the supervision based on the risk. So for that particular risk, if she's saying, "I'll cut you deep," we got to have close and constant supervision, because we know that she is at a high risk to self-harm. And then we just kind of go through each risk that's identified. When she's silent, uh, that could be something physical. She does have a megacolon, and so there's some risk related to that. So we have to make sure that she's feeling well. What the support must look like. Then we get into, we have to have some documentation on bowel movements. We have to make sure she's getting her medication, and staff are kind of attentive to those things. The supervision is going to be identified, and this would be a visual supervision. So we've got to keep eyes on her at this point. And then the who is responsible is important as well. Her day program or residential provider. In these cases, it would be it would be as wherever that would apply. And as I mentioned, it's for each section here. So we kind of go through each section and just kind of build off of what we've pulled over from that risk section.
And I think, Jim, when we're looking at what support must look like and why the person needs that support, it's so important to have those conversations, with the team. And sometimes we'll talk about the risk that we have, and people have different ideas on how to support that person. And just having conversations again, let's look at this, because each time you go over, let's face it, there might be something new that you learn, or something that didn't work in the past now works, as a support, or the person has learned skills that, okay, now the support is that they will find a quiet space, and sit down and just kind of relax. So I just wanted to kind of point out that having those conversations and what kind of support they may need might be a conversation, that you want to take a look at.
Right, absolutely. And this isn't really, it doesn't have to be any more difficult than it is. Like, we're just writing down what we're doing, or what we would expect the staff to do to help support the person. I think sometimes we run into some issues because we're not used to that, or we maybe are used to just kind of checking a box, or whatever the previous way might have been. We want to kind of capture it a certain way. In this section, we can be very clear on how we want that support to look, and we just specify what that needs to be. And again, this is in the ISP portion. So we have this part of it was carried over, and then we're filling in the rest. Um, in this section as well, we also have the amount of time that the person can safely be alone, and this is something that we're calling out specifically. So if they're able to be independent and alone without supervision for any period of time, we're calling that out. And then for all waiver providers, there also needs to be a backup plan. So SSAs would identify a provider backup plan here. Remember that ICFs, you don't need this, you're it. So there doesn't need to be a backup plan for you all. So that's where this information would go. And again, this is in the ISP, so we're kind of giving you a little sneak preview. We would get into this information a little bit later on as we work our way into the ISP. But again, services and supports are another place where we can capture supervision, where we expect that to be captured, because again, this is what staff need to do, and this is what they're documenting on. So in the area of communication, you see there's some information there as far as what supports and services Rose may need. And if you look down here at the bottom, got my laser pointer again. I covered up half of it, but you could see that her supervision's auditory. But when she communicates, I'll cut you deep, then it's increased. So we're kind of calling out specifically what that supervision is going to look like when under certain circumstances. And so we can capture it here. Again, there's some repetition here, but advocacy and engagement, you'll see something similar. And then getting into safety and security, again, just kind of calling out specifically what that supervision will be. And, as a Q or an SSA, you can kind of frame this a little bit how you want. And, this is really, again, what's going to be documented by staff. So, if you feel like things might be a little too wordy in a sample, okay, you might be a little more concise, or vice versa. Like, you could really kind of structure it in whatever way that you want. I think we want plans to be concise so that staff are reading and following them appropriately. But I think kind of determining what that looks like might be a little dependent upon the specific county or facility. Okay, anything to add to that, Les? Anything that?
No, I think you did a great job, covering that. And, of course, this is, broke down into services and supports for both, the day program and, HPC, you know, and looking at, spelling out exactly who's responsible for what. So, looking at that, it just basically is all that rich information we've gotten from the assessment is obviously right here, and easy to look at, easy to understand. And I think you did a great job explaining that. So, no, I don't have any more information.
Thank you. I'll pay you for that later. But yeah, I guess the only other thing to point out here is when the IT solution is developed, the great thing is that this information is going to be populated onto a documentation sheet. And when I know a lot of people are focused on compliance, as a SSA or a Q, you're going to identify a certain frequency, and then as staff are completing that, they're going to be documenting on it, and we would just want to ensure that it's occurring at the required frequency. So again, we'll dive into that a little deeper once we get into the planning portion or the ISP portion in future gatherings, but just kind of wanted to show you how all that tied in with supervision. We had a lot of really good discussion during our gatherings. This is the informed consent page. If you notice, there's a question up here about restrictions being identified during the planning process. Yes or no? For Rose, there are. So in that case, we're going to answer these questions that are marked with an RM. Okay. So you see there's several questions as I'm making my awesome circles. You'll see questions that we'll need to answer about, well, what help do I need to keep myself safe? What's the plan to ensure that it's just temporary, that it's not a long-term deal? Good, bad things that we could allow to happen, that could happen if you allow this help. Other ways to keep the person safe. So we're just kind of going through, and I think we really want to make sure that when there's a restrictive measure in place, that we're informing the person what is happening and what their rights are, the good and the bad from it. So I think all of these questions are kind of geared toward that. If we do mark no here, then none of this would populate in the IT solution. So I think that's important to call out, that you wouldn't have to answer all of these questions if there are no restrictive measures. And then on the bottom part of that, I mentioned this is kind of the participation and informed consent agreement. So behavior support, these restrictive measures are kind of tied into the consent, but this is really consent for all. So if you're answering all of these questions, we're going through and we're checking that the person understands they can change their mind. They can contact someone if they want to file a complaint. There's questions that you're just making sure people are aware that this plan meets their health and safety needs, that they have rights, free choice of provider. So all of those different topics that you go over with them, we're kind of capturing it all here and just really summarizing that consent so that everything is sort of in one place and captured right here.
Jim, I just have a question. So, and maybe you said this and maybe I missed it, but so when you're looking at this consent, does this mean that they're consenting to the whole plan and the restrictive measures, or is that a separate thing? Are we looking at a separate signature page?
Yeah, so this applies to the entire Ohio ISP, and so all of it is captured here. So it's restrictive measures as well as the rest of the plan. Obviously, if there's a dissenting opinion or something that needs to be worked through, then then there would be a spot to capture that. But this information right here is where everything lives, and you get your
Right.
signatures and all is well, right?
I think that would make a lot of people happy.
It should. It should. Um, we did talk about the interweaving a little bit earlier, and I'm not sure we need to really go into too much more depth about it, but we talked about like how things could live in different places, and so when we always kind of talk about it in reference to restrictive measures. So within Rose's plan, for those of you who've kind of followed us throughout these gatherings, you know that we've talked about I'll cut you deep in communication, and how she says that, and that leads to some self-harm, which can also then live in safety and security. And then maybe there's some health repercussions or things related to it. So again, I think, and not just to restrictive measures, but to all experiences and all of these questions that live in assessment, there's going to be that overlap. So I think just kind of reiterating that part of it, that we're going to have some overlap. There's going to be some repetition, but again, all that upfront work that we do in assessment really is going to help drive what we do in planning. Les, do you want to share some things that maybe folks can do right now while we're waiting?
Sure.
We're doing some testing on the IT solution, but what can they do now?
So, we just want to really build awareness, and, we want to make sure that we are considering, simplification and, digging deeper, with the plans. And we talked about that today, about, just not using simple words and just explaining. The example was Rose enjoys holidays. We dug deeper and, had those conversations on why, and evaluate the current process to ensure that, we are aligning with the facilitation techniques discussed, in previous slides and in previous sessions. And, continue familiarizing yourself with the paper version of the OhioISP. I know that there has been a few counties that have started, and they're not doing the online version yet, but they have been practicing, and will be practicing for the next few months on the Ohio paper version. So we're just wanting really to build awareness and have conversations, with individuals and team members and DSPs, and, just let them know, what's coming down, the line.
Yeah, I mean, I know we've all kind of been frustrated by the delays along the way. We had hoped to be further along at this point, but what a great time to kind of learn those questions. And really, if you're a county board and an ICF, kind of looking at what systems you're going to have in place to kind of roll this out in a way that's going to work for your particular organization. And then you mentioned simplification earlier. Not just digging deeper, but like we also want to use words that people can understand. So like that's been a really big focus for the Ohio ISP. Like, people should be able to understand what you're talking about. Like, and that goes to, people who receive services as well as family members, direct care staff. We shouldn't write this in a way that is, has a lot of jargon or things that people don't understand. We want
Right.
people to know it and understand it.
Right. And so, we're looking at this, and you heard me talk about this before, but I'm just going to continue to reiterate it, because we are developing resources each month, and we're posting, and we're keeping it very active. We want you to use it as a support system, to go to the Ohio ISP webpage, and you're going to find, the Ohio ISP paper version in there. You're going to have the 6 elements document that, you're going to be able to use, the outcome guidance document, the trauma response, the OSAS map, the fact sheet. As a matter of fact, we just gathered all the questions up from all the regions across the state, questions that people ask, and we went through them, and they are now posted on the Ohio ISP webpage. And so there might be a question that you're thinking to yourself, geez, I wonder if this is one of them. And going through there, and what's nice about it is it kind of sections out. So if you're an SSA or QIDP, you can go to that section, and there's all the questions that have been asked that pertain to plan rating. If I was an individual and I had a question, you're going to push on that, and you're going to find questions that were asked by individuals or concerning individuals. So I just really want to keep leading you back there. And if you think that you would like, we're always looking for more resources. If you say, hey, Jim, Leslie, this would be a great resource, can you get together and get it developed, or can you help us with that? We'd be more than glad to do that. I'm volunteering you, Jim, so just so you heard that.
I heard it. We should have consulted first, but I'll be willing to help for sure. Les did mention the FAQs. Like, I think the best part about that is those continue to evolve. Like she said, as we get information and questions from you, we're trying to answer those questions. A lot of the questions that we have up there were from previous gatherings, and we'll have that'll be a dynamic document that's kind of ever changing. So keep checking back as that gets updated. And then just a few things before we close, and appreciate everyone who kind of jumped on here to listen to this what turned out to be a little bit of a lengthy summary, but we hope it was helpful for you all. Obviously, we're not taking Q&A here, but as part of our regular gatherings, we do have question and answer sessions, and people come and they ask questions. And again, there are things that maybe other people might or may not have thought about before. And so it's a really good way to kind of share information and network and kind of get at what we're going to be doing moving forward here. So you don't have to worry about survey links or CPDs or any of that. But I did just want to mention real quick is that for December, we are not having any formal gatherings. We're not going to be doing any virtual or in-person. Our December kind of gathering schedule is going to be more of it's just going to be a IT demo. So one of the some of our IT and communications team, I think they're going to be working on something that we'll put out in December. So keep an eye out for that.
Hey, Jim, I don't mean to interrupt you. I apologize.
No, it's okay.
Hey, I just wanted to kind of touch base because I forgot to say it also. With the question and answer, after you're watching this session online, you might have a question, and feel free to email the Ohio ISP email asking that question. We monitor it daily, and we try to get the answers by the end of the workday, but sometimes it takes a little bit longer because you stump us. And we don't have all the answers. So just so you know, if you have a question that you want answered after this, please feel free to do that.
And Leslie, what is said email address?
It's OhioISP at dodd.ohio.gov. And you want to make sure that you spell the word Ohio out and not use OH, because sometimes people do that.
All one word.
All one word.
No space. And then I guess just to wrap it up here, January, we are going to resume our gatherings, and those are going to continue monthly. We'll continue to kind of dive into the additional assessment questions. I think we have 3 left that we're going to get into and over the course of January and February. And then the plan moving forward, once we get to March, we'll kind of continue that bridging over into the ISP portion, and I'm sure there's lots of great discussion to come. I believe the January and February gatherings are going to be virtual. You know how the weather is here in Ohio, and between that and some of the demand that we've had thus far, I believe those are going to be all virtual at this time. So unless something changes, just kind of keep an eye out for that, for the links for those sessions. Leslie, great conversation. I appreciated
Absolutely.
you being here and kind of the back and forth.
Yes, I appreciate that too. I just wanted to thank you. And again, if you have any questions, please follow through. We also have regional maps that have both Jim and I's email address and phone numbers, so you can reach out to us.
As well as our other friends in different regions as well. So we have, you
Yes.
know, we have, sorry, I almost stopped the recording too early. We do have some other colleagues that do the work in different regions as well. So there's regional managers, and so that map that Leslie referred to is here. You find that on our website. So, well, thank you
Okay,
again,
Jim.
everyone, for attending. Leslie, great talking to you,
Thank
and we'll
you.
talk soon.
All right. Thank you.